Hello, everybody, and thank you for joining us. Today's seminar will be on healthcare and security and how moving beyond traditional security can deliver a better experience for patients and healthcare workers alike. Your presenters for today will be myself, Olivier Dumoulin. I'm the Regional Sales Manager for the AutoView Division here at Genetec, and with me is Nada Ebeid.
Hello, Olivier. Thanks for that. I am the Canadian Business Development Manager for Healthcare at Genetec. So today we want to talk to you about some of the challenges our healthcare institutions and hospitals face on a day-to-day basis. In reality, operational efficiency within a healthcare institution is a true challenge in terms of how do you minimize wasted time on whether it be events or alerts or just a lack of efficiency in processes. But then there's also, the real challenge in terms of making sure that there is both staff and patient satisfaction alike within the environment. And then the question goes is how do you ensure that you have proper operational efficiency as well as proper safety for both staff and our patients without compromising privacy? So whether it be the privacy protection from our identity or whether it be the data that we're collecting and making sure that they are secure. So healthcare needs are changing, and the reality is that the threat landscape is something that evolves continuously. And therefore, we really have to be able to think of strategies in terms of how can we be agile for the next situation that may come up. And I think there are two very clear examples that we could refer to. One is cybersecurity. Cyber attacks today have become extremely more sophisticated and targeted. It's no secret today that data has actually surpassed big oil when it comes to from a valuation perspective. The other example that's quite evident to us all here today is the pandemic. Through the pandemic, our security operators in healthcare institutions had to face scenarios that they hadn't necessarily foreseen. Luckily, or I shouldn't say the word luckily, but there were other events in the past, such as SARS and other pandemics, that basically helped our security operators plan for certain aspects. But this particular pandemic really put our security operators in a situation where they all of a sudden had to adapt to having to supply makeshift environments, whether it be through hotels or a makeshift hospital in a parking lot. So this ended up by causing quite a bit of changes in the day-to-day for security operators. Also, there's an increase in data demands. The administrator leaders are really looking for proper data so that they could guide their decisions and guide their planning. And the reality is in a lot of systems today, it becomes very, very complex and difficult to extract some of that data and have it work for you. And so we end up by putting a huge amount of burden on the operators so that they could help us gain awareness in some of the decisions that healthcare operators are taking. Now, I'm going to be sharing with you a few staggering statistics here. The first one comes from the Canadian Federation of Nurses Unions. So this, this statistic, or the report rather, I should say, shows that the incidence in healthcare workers has increased at a rate 3 times that of police and correctional service officers. It's quite impressive to see, that graphic is quite evident to show that graph is really on the rise. So it's really pointing to a situation that's happening in healthcare institutions that I think perhaps because of the type of environment that they are, we hadn't necessarily put the proper technologies in place to help contain the risk. Now, this reality is not true or is not limited to only Canada. It actually extends to the US as well. Statistics there show that the violence occurring within healthcare institutions is 4 times that of the private industry. And actually 2/3 of the incidents against healthcare employees are actually caused by patients, their families, or visitors. Now, this one is particularly impressive. 61% of nurses have experienced abuse or harassment an assault within 1 year. 61%, that's 6 people on 10. So this is really something that we really need to think about. We're going to switch gears slightly here, and I'm going to ask Olivier if you could jump in here.
Thank you, Nada. Those are very sobering statistics, and it confirms a lot of the suspicions we had. We started surveying a lot of our customers in order to understand the reality a bit better. And one of the things we did is we spoke to our healthcare security operators, and most of those we spoke to claimed that at least 40% of their daily security alarms were not founded. And so that brings you to a situation where you may be dispatching resources for a false alarm and not on a real alarm that could be happening at the same time. So that's pretty scary. Another thing that we did is we actually spoke to our healthcare customers before and after the installation of a new automated security system for their parking lots. And we asked them to estimate what their non-compliance rate was. And they gave us some numbers, and when we checked the reality with the automated systems, we actually found that the rates were 10 to 12% higher than they expected.
So what we're saying here today in this short seminar is that the security system that you have within your healthcare facility should really help you do more and really help you move beyond the security. So obviously, whether it be video surveillance system, access control systems, intrusion systems, obviously these systems are absolutely important within an environment, any environment, and particularly in a healthcare institution, to make sure that you have the proper means to ensure the proper security of the perimeter. However, there are ways of extending the use of the security platform to really help you improve the experience for both the patients and the staff workers. And that goes by being able to have proper situational awareness in your environment and be able to contain risks, mitigate risks as soon as they arise, or maybe even be proactive and mitigate them before they occur. Now, of course, you want to be able to do that by protecting the privacy of both the patients and the staff. So that means that you need to ensure that your technology that's in place is pretty robust, either against cyber attacks, whether it be through advanced protocols and encryption, and also in process in how you're protecting the information and who is allowed to access the information. So that ends up by being quite important in terms of being able to protect the chain of custody of the information. But then you want to push your security platform further. You really want to be able to leverage your security platform to help you be more efficient every day. And that goes back to something that Olivier mentioned earlier. That time wasted on false alarms, it ends up by being extremely important. If a security operator is responding to a false alarm and is not able to assist a nurse who may be in a difficult situation, that's really a huge impact, and we want to be able to avoid these things. So by pushing your security platform to the next level and bringing all of the information together, whether it be your video, your access control, your analytics, your maybe even your license plate recognition technology, whatever you may require, bring that in all together, have it work for you so that you could be operationally efficient and reduce the number of alarms within your environment. But perhaps you could even push your platform further and allow you to find new ways to generate revenue for the hospital. Now, of course, in any type of building, there are a lot of standard operating procedures, a lot of regulations and internal processes. All this takes a huge amount of time in planning and in implementation, as well as in execution. And so what we're proposing is to leverage your security platform to help you be compliant, but in a much more efficient way, by having your system perhaps automate a lot of those procedures within your environment, whether they're automating it through technology, but also perhaps automating the process in terms of how the operator should respond to particular events within the environment. So So here we're going to move to a question period.
So thank you, Nada. I have a question for you. So we see that obviously COVID has been a major game changer everywhere, but especially so in healthcare. It sounds like some of the impacts may be worse than we realize, and maybe in fact exacerbating existing problems.
Yeah, that's a really important question, Olivier. One statistic that we didn't share today in the webinar is that actually through the Canadian statistics, we've proven that 53% of violence that's occurring in a workplace environment is actually not reported. So I think there are several ways in terms of how we could help the situation, and I think one of about it openly today, and I think more and more people are talking about this reality within our healthcare institutions. So I do hope just by doing so that we're going to be take advances in being able to reduce that number and really help our healthcare professionals work in a safe environment. But I also feel that obviously technology can also come and help some of these situations. Now, I was listening to an interview last week, actually, and there was a hospital in Ontario that was talking about how they knew because of the pandemic that they were going to have to close the doors to visitors. And immediately they anticipated that there was going to be a rise in violence. And so before making the announcement that they were going to close the door to the visitors, they were proactive, and they ended up by calling the police ahead of time to make sure that they were going to be able to contain the risk. So I think the pandemic has definitely increased a lot of hostility and stress for everyone involved. And so, yes, of course, these statistics that we've shown related to violence is actually pre-pandemic. So today's environment is even more hostile than we can imagine.
That's really that's really sobering to think about. So I also know that providing duress mechanisms to workers and having the ability to dispatch security are key concerns for healthcare managers. Do we have anything to offer them?
Yeah. So I did allude to technology being able to help us. So the answer to your question is yes. One of the ways to help mitigate a situation like that, there's technology that we call real-time location services, or sometimes abbreviated to RTLS. So this technology is not new. This is technology that has been used in hospitals for a really long time. However, it is actually quite costly to implement, and therefore the usage of RTLS has been somewhat contained within our hospital environment. However, the technology has evolved quite a bit, and today there are real-time location services based on Bluetooth technology, which make it a lot more cost-effective to deploy. So in a scenario of hostile environment, what you could imagine is a nurse carrying an access control card that would give them access to particular areas. But with that access control card, they would have another card that would have a button on it, and it's a duress button. Now, picture an aggravated scenario. A patient perhaps is being hostile towards a nurse. The nurse ends feeling quite uncomfortable, presses on the duress button. Now, what happens immediately, the security operator gets the event and the alert that there is an event going on, but will immediately have that information associated with the video. And therefore, the security operator immediately has eyes on the situation and can quickly assess how the situation may escalate, and may even send an audio message through a speaker, or perhaps dispatch a security operator to go and contain the risk immediately. Of course, there are other ways of adding to this solution in terms of it could be audio analytics or video analytics that could help you detect prior to even to the nurse pressing on the duress button that a situation may be escalating. So these are all technology, whether it be through RTLS or analytics, and being able to contain that with knowing exactly where that event is occurring in the hospital and being able to have eyes on the situation could really help you contain the risk.
Yeah, I think those measures would make a real difference. Absolutely. Again, if we examine the reality of healthcare through the lens of COVID, I know that contact tracing and PPE supply management have been repeatedly mentioned. Can anything be done to alleviate those issues?
Yes, for sure. I mean, Contact tracing, this is something that, very, very key to help us contain the risk. I mean, we know it also through our government was asked us to install the contact tracing application on our mobile phones. But if you look at that within a hospital environment, when you think about it, the data is somewhat already contained in the access control system. So what Genetec did is basically release a report that would allow the security operator that once a person is either confirmed or suspected of having COVID to quickly be able to go into the report and get a quick assessment in terms of which areas they had access to and who else may have been in contact with that individual and those areas within a specific period of time. Now, all of this, because the data is there and that we were able to crunch that data really, really quickly within a report, it really gives the operator the tool set to be able to have that report within seconds as opposed to hours of searching through data and cross-correlating information. The second part of your question, actually, Olivier, was around PPE equipment. So, of course, this is something that I think is a little bit more under control today in our hospitals. But initially, when the pandemic, occurred, there was, stress levels from patients, visitors, and even hospital workers and staff in terms of not having enough PPE equipment. So there were a few hospitals that actually approached us and asked us, is there something that Genetec could do to help us? And so what we actually released was an application that would allow you to, through your access control card, you would have to scan it through this application and identify what PPE equipment you may be taking for the day. Now, all of this information, basically the transaction, if I might call it that, was also being recorded. And obviously, that recording by itself deters, the abuse of taking more inventory than required, and also then claims. So really allowed the hospital workers, the intent was really to allow them to contain the inventory. Yeah. Sorry, I lost my train of thought there, Olivier, but go ahead.
What about monitoring occupancy in indoor areas for social distancing reasons?
Yeah, that's an important point, because obviously, containing the risk is, yes, by being able to know who may have been in contact with a particular suspected or confirmed COVID case. But of course, being able to be proactive from the get-go and be able to mitigate the situation is actually even better. So how can you, determine, the maximum number of people that should be in a particular area, but take that a step further and be able to detect when the maximum occupancy has occurred. Because from there, you could take several measures, perhaps, send a message through a speaker, perhaps lock the door, perhaps dispatch a security operator in terms of containing the risk. So the way that's being done is, again, it could be either through LiDAR sensor technology or video analytics that would allow you to count the number of people in a particular space and making sure that you have the rule sets configured so that if a threshold is reached, you can actually take the steps after to bring the situation back to normal.
Well, it's really good to hear that there actually are solutions for these important problems.
Yeah, I agree with you, Olivier. I actually had a question for you. You mentioned a very interesting statistic earlier. You were talking about 12% increase in non-compliancy over than what was expected. But even for myself, and I'm sure for some of the fellow audience here, that 12% may not compute to an actual tangible. So can you break that down for us and explain that 12% in non-compliance? What does that represent for a hospital?
Of course. So basically what we did is we asked them to estimate what their non-compliance was, and they told us, 2 to 3% on average. But the reality was it was more like 12 to 15%. So that's the difference between a minor nuisance and a really significant issue. We look at the Montreal area healthcare service centers. They've accrued about $4.8 million in parking revenue last year. So that means about $500,000 to $600,000 that could have been used to fund caritative foundations or offset operational deficits. So that's a difference between renovating a patient area or waiting another year. So it's definitely an impact on patient and worker experience, and we also know that many of our customers globally are also in a for-profit paradigm. So that becomes a whole other discussion.
Yeah, that's very interesting, Olivier. Thanks for breaking that down. I think sometimes 12%, could seem somewhat like a small number, but when you put it in those terms, that's nearly $600,000 in that particular scenario. So that's a massive number. So this example that you gave was really based around license plate recognition and how that was leveraged to manage non-compliancy within a parking lot. But I'm just wondering, are there other applications outside of parking that could be leveraged with license plate recognition technology?
Yeah, there absolutely are. So, the fact of the matter is that when you install an LPR system, you gain the visibility over the outbound and inbound traffic to the healthcare site, and you're therefore extending the perimeter of your security system. So security-wise, it really helps with investigations and crime prevention. You can detect stolen vehicles very easily. In terms of curbside management, when you're monitoring or detecting unauthorized or unsanctioned activities like parcel or food deliveries, that's really impeding the flow on the facility. You can also go back to the workplace violence discussion. If you're detecting the vehicles coming in, you could potentially prevent an unwanted person who's known being involved in a violent situation. You can prevent them from reaccessing the site. You can also prevent vehicles from impeding the flow of traffic, like using lanes or accessing certain areas that are reserved for emergency vehicles. Or you can also prevent them from entering throughways in the wrong direction, or preventing vehicles from stopping or parking in areas that are strictly reserved for pickups and drop-offs. So that makes a big difference.
Yeah, it's fascinating what we could do with a camera, right? So tell me, Olivier, we spoke about some of the parking challenges that hospitals have to deal with. But I can't help but wonder, I know here in Quebec we have very specific parking challenges associated to our province, but I'm sure that some of these challenges will not be the same, perhaps even in British Columbia in Canada or other parts of the world. Can you shed some light in terms of how different areas in the world, how their challenges differ from one another?
Yeah, for sure. I mean, if you think about certain regional or suburban located healthcare centers, they may have absolutely no occupancy problems to begin with. And so there's no concern there. Maybe their parking is not even charged, and so loss of revenue is not a concern. Here in Canada, we are not in a for-profit paradigm, and the reality is different. If you have a healthcare or a hospital that's located in an urban or major urban or downtown area, it becomes very different because maintaining accessibility to the site is a major challenge. And if the healthcare workers, for example, can't easily access parking, then that could become a challenge because they may not be willing to. You're going to have some recruitment or employee retention challenges because these employees have options and they may choose to work somewhere else, and then it becomes a real impact on the healthcare services you're able to provide and the having enough frontline workers, for example.
Yeah, of course. I mean, we wouldn't want, we wouldn't want to hinder like a healthcare physician of getting to perhaps a surgery on time, just like we wouldn't want to hinder like a patient being able to get to their surgery on time. So it's quite interesting to see how, depending on, whether you're in a downtown core or in an environment with a lot of space, you're still going to have to manage that non-compliancy, but the impacts of that the impacts will be very different from one area to the other.
Yep, absolutely.
Well, great, Olivier. It was great chatting with you today. Right now, this actually ends this part of the webinar, but we're opening the floor for questions from the audience.